Good evening, everyone. My presentation here is on overuse injuries, overtraining, and burnout in young athletes. And why did I choose the article? The article is called Overuse Injuries, Overtraining, and Burnout in Young Athletes. Um, it really relates, and the article gave me a jump start to my topic and my research question here, which is what key risk factors contribute to increased injuries in youth sports. It gave me a jump start as I was looking for articles. To be honest, didn't really see these three terms before: overuse injuries, overtraining, and burnout. I Before I read this article, I kind of understood what burnout is, but now after reading the article, I really learned what it is. And we'll dive into these three terms as we go. And it also speaks about how physical activity can be a benefit and a risk for young athletes. Let me just move myself down here. I apologize. So the research background, um, the of course, young athletes' participation in sports are at a high percentage. It speaks about specialization in one sport, meaning that a young athlete can play soccer, right? But specializes in soccer, meaning that they're not playing basketball, bowling, badminton, tennis, or any other sport, just strictly on soccer. Um, and that percentage is high as well. And then, of course, injuries are increasing in young athletes while the percentage of participation is high. So is injuries. Some of the main research questions: why are young athletes experiencing higher levels of injuries? Is specialization in a single sport increasing those injury rates? And what causes burnout for young athletes? And before we get into here, want to go the other way? Thank you. Before we get into the theoretical background here, I just wanted to go over the three terms. So overuse injuries are injuries of cumulative microtrauma to the bone and muscle from repetitive exercise or training. Um, the article dives into how in young athletes these overuse injuries mainly, not always, but mainly affect the lower leg area. It mainly affects female young athletes and endurance sport athletes, which of course involves lower leg exercises. Um, and of course, prior injuries from certain young athletes are more at risk for these overuse injuries. So one risk factor is specialization, and we spoke about that in the previous slide. Playing one sport, we'll go with basketball, and it's been a trend that we've seen, or many have seen, with the NBA players. Now they're not young athletes, but that is a perfect example of how we can take overuse injuries. A lot of players this past season have had unfortunate Achilles injuries, Achilles tears, and which is at a constant rate that we haven't seen before for the NBA. So think of it like that for the young athletes, where if playing soccer, basketball, football, right, affecting the shoulder area, the arm area, how specialization can be a risk factor. Um, Now, overtraining, of course, is having excess exercise, having too much training without having enough recovery time or a lack of recovery time per se. Um, and then there are many risk factors that honestly I didn't know. Of course, one of the risk factors, as we said, is recovery time. But there are other risk factors such as lack of sleep, stress, fatigue, um, and illnesses and previous injuries, right? These are risk factors that I didn't know going into this. And then burnout. Burnout is very complex. I have always thought burnout as being very simple, but here is burnout. Burnout is you have a young athlete, right? And they have a huge drive to play a sport that they're interested in, whether it be soccer, basketball, etc. Um, and they have a big drive. And unfortunately, at even though youth athlete participation in sports are high, there is a high percentage of those very young athletes quitting in the later years of their sport career. So that kind of is burnout, where you lose that drive and you have a lack of drive to continue in this sport. Um, and there are many factors, symptoms per se, of that. And before we get into those symptoms, which is in the next slide, just wanted to talk about the theoretical background. It's focused on risk factors of the overuse injuries while discovering some preventative measures young athletes can take after learning about those risk factors to prevent or eliminate any risk of injury. Excuse me. Speaks about burnout and mental health, which we'll get to in the next slide, and then overtraining comparisons to adult physical activity. And here it is, the research methodology. The article is a clinical report, um, indicating in my wording a summary of past discoveries, which now dictates this research method as a qualitative research method in the terms of case study. Um, and we have these two graphics here. On the left, we have burnout symptoms. And then on the right, we have certain overuse injuries and the common locations. So we'll start with the left, with the burnout symptoms here. Of course, we have fatigue, right? Burnout, as we described it, as being a loss of interest or motivation. Um, a unexplained musculoskeletal complaint, basically soreness, feeling pain in the body, right? But then it dives into sleep disturbances, depressive symptoms, being irritated quicker, having symptoms of anxiety, lack of concentration, even weight changes. These are symptoms that I didn't know going into this study, into this article here, that would be involved in burnout. Um, and then on the right here, we have certain injuries, and we have it from patellofemoral pain syndrome, right? Um, Located in anterior knee. We have bone stress injury, which is located in the tibia and the lumbar spine. So these are just a couple of studies grabbed from previous studies, right? Because this is a clinical report, and we'll get into the strengths of weaknesses of that. But one of the weaknesses is that it's not an actual study. But we'll get into that as we go on. Um, Of course, the strengths, as we said, since it's a clinical report, it involves multiple data from different studies and reports, and we can call that a holistic approach, which basically ties multiple data together, and proven data, right? It's not just thoughts being put in, it's from multiple AAP reports. And the study has been proven to determine benefits and risk factors. And then once we get to the weaknesses, since it's not an experiment per se in this actual article, the data found is not original, right? It's from previous studies, although the previous studies are great, um, very informal, has proven data. Um, the data is limited, and I wrote here, in certain situations, adult data was used in the case study. So, one of the biggest things that the article spoke about was endurance events and how that can be beneficial for young athletes. However, they did not have enough data. And so, what they did was they grabbed data of how it was useful for adults and compared it to the data that they had for the young athletes. So, that's kind of like a weakness, because in certain cases, it can cause a sense of bias, um, and people that are trying to read the article or research the topic, research this very article, can say that the author of the article is trying to find different data that's not original and piece it together to prove the point, right? But um, in my opinion, that's not the case. I really found this article to be informative, and here, what I learned from it is that this is the beginning stage of my research process. And it made me brainstorm how else I can research about the topic and to actually find an experiment article, right? That has an experiment, that has study, and compare it to this article. So that way, if I can find data that relates to this article, then I know this article is very, very informal, and I believe that to be the case. And I learned that participation in multiple teams in the same sport can increase the risk of injury. As a coach, I coach soccer at the club, at the youth club level, and at the middle school level. I have players that play multiple levels of the sport at the same time. So I personally thought that as a fresh new coach, this is my second to third year now coaching. Since I started coaching, that was a trend, and I've always thought that to be all right. But it can be, it can increase the risk of injury, um, especially if the young athlete doesn't have enough recovery time. And then I have a question for you all. Do you believe that sports should be limited for young athletes, right? And that ties in into um, having the lack of recovery time. Do you believe that sports should be limited for young athletes? So that's just something that you guys can think about after seeing this presentation of mine. And here's the works cited. And let me know, guys, in the discussion. What do you guys think? Thank you, guys.